It's good to discuss about maternal fetal and neonatal medicine because this is one field which has been neglected for a long time in India. If you look at countries like UK, Europe, Australia, US, all the countries have progressed when they reduce the quality indices. The quality indices of maternal, fetal, and neonatal medicine is measured by maternal mortality rate, infant mortality rate, and neonatal mortality rate. I don't think anybody in India until last 10 years talked about the neonatal mortality and maternal mortality rate in a big way. For the last 10 years, the focus has shifted with the various programs which has been initiated by the various governments like Pradhan Mantri Surakshit Matritva Abhiyan, Ashitra Kishore Swasthya Karyakaram, that is RKSK, peer education program, teenage program, and various other programs like even Lakshya, where labor room quality improvement initiative and maternal death surveillance response reports have also made the maternal focus on maternal medicine in a big way. And there has been a increasing awareness and reduction of maternal mortality and infant mortality in a big way. So finally, we are seeing gradual and rapid decline in these mortality rates, which is a good thing for India. But we have a long way to go if we want to reach the statistics of the European standards, if you want to call, or developed world standards. The other thing which we see here is the discrepancy. See, for example, we have states like Kerala where the quality indices of maternal mortality and infant mortality is as good as the US, whereas we have states like Haryana and Bihar where the statistics or indices are as bad as Africa. So we have to have a uniform standards throughout the country. For that to happen, there has to be a healthy competition and move ahead. So hopefully we'll reach there in a few years. India is a huge country with the level of standards, as I mentioned just a few seconds ago. The standard of quality of care is grossly different between the different states, and the state-wise burden is what is being focused now compared to what it was in the past. In the past, everybody talked India as a whole. Now, for example, in 2017 May, the government of India actually introduced pneumococcal vaccine to 4 states in the northwestern part of India where the deaths due to pneumonia was the highest, and pneumococcal vaccine, conjugate vaccine, has been shown to reduce the deaths due to pneumonia all around the world. And on an experimental basis, in May 2017, these 4 states were selected and introduced, and the results are expected anytime now soon. After that, it will be introduced rest of the country. Once that sort of steps are taken and we are focusing on targeted areas and targeted states, our health indices definitely is going to improve. There are a lot of good learnings from various parts of the India, but the healthcare standards across the country is very patchy, with some excellent areas, some poor areas. It's not like the whole country is bad, but we have to learn from the areas of excellence, and here we have a lot of collaboration that can happen. Everybody asks what is Cloud9 doing it, but what we have to understand is Cloud9 is a very young company. We are only 13 years old, and when we started, no one would believe that maternal and neonatal care medicine can make a huge difference or dent in the industry, in the healthcare industry in a big way. And we believed in our thought process and our quality care. And when we did in one center, they said, well, this is achieved in one center, but not necessarily replicable. So we have replicated our standards, which is almost 0% maternal mortality and 99.3% survival for babies across the country in all our centers. We have nearly 20 centers across the country now, and our standards are living proof of what we have achieved. Now, to replicate this in the public sector, we have initiated processes, and we have actually taken participation in quite a few public sector And also we have initiated various accreditation programs for breastfeeding associations across various industries. We have also initiated lactation support to PHCs. We have also initiated lots of support to the charitable organizations by providing doctors in health camps and various other issues. We have recently formed a Cloud9 Foundation to make this as an organized way of doing things. So in the next few years, we are planning to do various other activities which are going to hopefully make a huge difference. We've even offered the government our expertise to initiate a lot of public-private partnerships. We have initiated electronic and central NICU, tele-NICU programs in all our centers. With that, we should be able to offer hub and spoke models of healthcare in reducing infant mortality across India, any part of India, because we'll be collected by Bluetooth technology and wireless technology, which has become so widely used by a common man, and there's no reason healthcare cannot be improved on that basis. That is going to make revolutionary changes in the healthcare system if it is implemented properly. And I know in Cloud9 we have been digitalizing our records, if you want to call it outpatient records and inpatient records, in a big way for the last 13 years. We have only achieved all the doctors using the digital records only for the last year or so. So it is a big task, and without digitalization you won't have the data. Without data you cannot proceed any further. If you look at, for example, Denmark has had a data analytics for the last 60 years, even before computers became available. And only because of their data analytics, they could identify that thalidomide, which was a drug, caused limb abnormalities a few years ago. So once we have the data, then we can analyze and we say this is what is causing the problems, this is what is improving the health standards, and this is what we need to focus on, and various things. So collection of data is the most important. Then data analytics comes into picture. Without data analytics won't happen. Without data analytics, healthcare standards won't improve. So it's all interlinked. And hopefully a country like India with 26 million babies being born in every year, we should be the leaders in the world for maternal and neonatal care rather than following somebody. And if not for the world, at least for Asia, we should be the leaders in virtually every healthcare policy relating to maternal and neonatal care, with so many births happening in India every year. Rural health is a big concern because there is a discrepancy between the standards of healthcare in the urban and rural areas, because there is a various issues, not just the availability of the doctors. Number one, transportation. Number two, the quality of care available. And number three, the investment in the infrastructure and communications and various things. Just to give an example, for example, if you drive 100 kilometers from Bangalore, you won't find any doctor who can do lung function tests for an adult who has asthma. I'm just giving you one example. And to diagnose asthma, to do lung function tests, if you don't have an equipment as common as that, you can imagine why anybody will invest in another equipment. Number one. So investment in a rural area is much lesser. Second thing is, the super specialists who are required to provide quality care are not available in the rural area, because many of them who are trained for various reasons, they would prefer to stay in the urban area purely for their lifestyle and for their family lifestyle rather than going to rural area. So the only way the healthcare in the rural area can improve is by doing some sort of telehealth or hub and spoke model. Otherwise, the rural health will remain rural and urban health will remain urban, and the difference is going to be maximizing problems in the future. So what Cloud9 we are doing is, as I mentioned in the previous question, we are establishing tele-NICUs in all our Cloud9s with the hope of providing hub and spoke model care and improving the special care and neonatal care and maternity care in the rural area purely by connecting them via technology. And necessarily, if anybody is required, they are brought to the regional centers. and that way the standard of care is going to be improved in the rural area. Otherwise, if you are waiting for a super specialist to go and work in rural areas, that's a big task. That's very close to our heart. In fact, we are one of the, I should say, one of the very few chains of the hospitals in India where we have encouraged clinical research, and we have been pioneers in this field. In fact, 11 years ago, there was a company called Embrace. If you Google, you will find out they created a low-cost warmer, and they're a Californian-based company with Indians working there. And when they wanted to launch it, they wanted to do a pilot study, and we were the first chain of hospitals who did a pilot study. And because of that, then they went on to get a lot of awards, including the Time Innovation Award, and also they got a lot of investors. And now it's an international company who has been saving lives with a low-cost warmer. As shoot off from the pilot study, we published our studies in British Journal of Archives of Disease and Childhood. We have continued that trend. In fact, last year we did a pilot study on remote monitoring devices from Chennai. One of the startups had created a small device where they can monitor the heart rate, respiratory rate, temperature on children without a nurse going into the room. Means the nurse is busy with 3 patients. You can actually look at your mobile phone and say, this child is not doing well, sick. And that's a startup, and we definitely did a pilot study. And that company now is producing commercially all these equipments. We are doing 3 more trials on various equipments, which are the startups again, like a remote monitoring of pregnant women at home, either through mobile phone or through Bluetooth technology with monitoring device in the computers in the hospital without them having the need to come to the hospital. In fact, we have another equipment whom we have just done a pilot study where we can think of providing the phototherapy for the parents to be given at home rather than all the way coming to the hospital when the mother is either sore for various reasons or she doesn't want to come. Then we can offer. So in that way, we are helping a lot of the startups, and we have been very fortunate in having many startups which are Indian based, and the healthcare innovations are surprising us considering the number of startups we have been helping them. India is a very mature market, but what you have to understand, if you look at the global market, there is no country in the world which has managed to provide the healthcare to the entire nation by government itself. The only 2 countries which has been providing the complete healthcare from start to the end are UK and Canada, and they are struggling and their services are crumbling because the healthcare costs are increasing exponentially, and especially the cost of aged healthcare and oncology, which is the cancer care, has been skyrocketing. So at some stage we need to have a combination of private healthcare with the public healthcare, something like Australia, which has got a balance right in a sense, and the rich will pay for the private healthcare, poor will subsidize the public healthcare, and the combination is the way to go. And definitely we have a lot to achieve if we want to attain the good healthcare for the whole country, especially in a country where 35% of our population are under 35 years of age. So the healthcare needs are going to rise exponentially in the next 10 to 15 years, and we have started thinking about it, but we have to invest in our future.